It's a great pleasure for me to talk today to Dr. Maria Ferris and Dr. Catalina Alvarez. Dr. Ferris, she is a professor of pediatrics at University of North Carolina and director of the transition program. And Ana Catalina, she is a pediatric nephrologist from Mexico City and currently a transplant fellow at the Hospital for Sick Children in Toronto, Canada. So welcome, and could you just say a few words about your talk at the RRI conference?
Certainly. Thank you for having us. Ana Catalina and I are excited to be invited to this conference, and we will talk about the process of healthcare transition. We will discuss about how our adolescents and young adults continue to need help when they graduate and go to the adult-focused services.
Thank you. And I mean, transition medicine may not be a household name to everybody. Can you just explain what transition medicine actually means and why is it important to study and really clinically also exercise this transition between pediatric and adult care?
Sure. Transition can be defined very simple, but it's not a simple concept. It's basically transfer the care from the adolescent and young adults from the pediatric medicine side to the adult care side. But it's to transfer the complete care. And if you think about this word of complete, it involves all the aspects in the care of a patient with a chronic condition. It is very important because the environment where our pediatric patients develop and grew up with their disease, it's different than the environment in the adult side. In the adult side, they have to show independence and to be able to know and handle their own disease. So for these kind of patients, these chronic patients that the parents and the healthcare providers are parenting them and all the time taking care of them and controlling them, it is a shock to face this kind of challenges in the other side because they are used to take care from others, not to take their own care in their own hands. So it is very important to study about this and to be aware of this. And it is very important to acknowledge that it's a complex concept, despite I'm trying to explain it very simply.
No, thank you. I mean, this, I believe, is very helpful for those who watch us. So, Maria, can you say a few words? What is actually the goal of a successful transition?
It is difficult to define what is a successful transition. We published a couple of publications with multidisciplinary input about what defines a successful transition. But most of us agree that if a patient is able to manage their disease, understands their medications, understand the importance of adherence, understands what happens in their adult life and how their health will change, and manages to be adherent to treatment, as well as having a good health-related quality of life, those are what we call successful transition outcomes.
Yeah. And I mean, how frequent are actually transition programs in the US and how difficult is it to build one?
Well, I cannot talk a lot about the experience in the US. I will leave that answer to Dr. Ferris. But I can talk about a little bit about Canada, although I've been here not for so long. And I can talk about Mexico and Latin America. In Mexico and Latin America, it's not very common. It's not a concept that we used to know. We get to know it through Dr. Ferris and other physicians that are actually pushing or trying to pull out this kind of initiative. And it is very hard to build it. It is very hard, but not impossible. It's hard to build it because it's not a known concept, so it's hard to get funding for it. Mm-hmm. And it requires a little bit of people involved on it to make it successful. However, I'm saying it's not impossible because even in developing countries like Mexico and low resources sets, you can find volunteers and you can find the way to build up the program and to make agreements with the adult set to be able to build a program. And I leave the answer about the US for Dr. Ferris.
in the US, it's not as easy as well, but it is possible. One of the important things that we have discovered through conversations with people around the country is that if you have a champion that could cross over both to the internal medicine focused providers and to the pediatric providers, you will be more successful at having a program. Also, what we have found to be another key for success, if the institution where you work supports these efforts by providing the funding for a transition coordinator.
Yeah, Maria, you're really one of the pioneers of transition medicine. Can you say a few words about the challenges you faced actually when you came up with this concept, and how you would overcome them?
One of the challenges I knew is how to do the program, how to measure the process of healthcare transition. How do I know when someone is ready and someone is not? And there was not really a way to quantify a field that had been full of opinion and full of anecdotal information. So we came up with a number of tools to measure healthcare transition. Those tools have been used not only for the patient, but for the parent as well. And we came up with other tools to help patients learn about their disease, manage their disease, and communicate with other providers. We've been doing this since 2006. We have over 70 publications with collaborators from across the world, mostly from Latin America, and we are finding our way. We have learned that protective factors for healthcare transition include a good literacy level of the parent, but if they don't have that great literacy level, we have turned down our patient instructions to 4th grade reading level. So we have managed to take our experiences and translate them into direct care.
Yeah, now what really interests me is, when does the process of healthcare transition preparation actually begin and when does it end?
So this is a very good question, and Dr. Ferris has done a lot of research about this, and she has a few publications about the way our kids, when they become adolescents, learn and what they are capable to understand across the different ages. It is very important to start early, meaning around 12 years old, because it was believed before that just a few months before transition, the patient, it was good enough. And Dr. Ferris has published enough evidence to say that we need to start way much earlier, because the skills that the patients are developed through their life and through their growth are different in the different age groups. So it is very important to start early. And the other, and when does that end? It is, I don't want to say it ends when you deliver them in the adult care, because even adults need to keep working with them. That's why Dr. Ferris says that it's ideal to have a person that actually is in both sides, ideally. But if this is not possible, to deliver the care personally to the other physician, it is important, because there will be some challenges for these young adult and adolescent still that the adult side need to keep working. So it doesn't end right now when they get into put their first foot inside of the adult hospital.
Yeah.
If I could expand a little bit on your answer, we actually have learned that patients don't learn to do self-management of their health condition until their mid-20s. So it also coincides with the when the brain is fully developed, which is when you're about 25, and those are typical brains. Our patients, unfortunately, have at times some delay in cognition, so it may be at an older age. So I know that a lot of our audience is going to be adult-focused providers, and I want to ask for their patience and support on these young adults who are still learning and who are still under the care of parents in many ways.
Yeah, and this brings me to a question. What is the role of parents actually in this transition process? How do you interact with them, and what's your experience with that?
So one of the things that we have discovered in our lab is that when we ask hundreds of patients, adolescents, who do they prefer to learn about their disease? It was their parents, number one. And that was a surprise to us. And number two, health providers. We have also learned that those who prefer to learn from their parents have better adherence to treatment, whereas those who prefer to learn from their providers know more about their conditions. So that took our work to focus on parents, and this is why we have tools that measure transition readiness for the parents. We also have learned that many parents that have different parenting styles predict transition readiness. So our work is now focusing on empowering parents to let go, teaching them when to delegate duties so that the patients can be the drivers and no longer the co-pilots over their healthcare.
Yeah, so really thank you. I mean, these are so important insights. And, we are so proud to have the two of you leaders in the field at the RRI conference talking about transition medicine, something that you clearly have pioneered in this country, and you are shining examples also abroad. Now, I mean, we live in strange days, and I'm very, very interested, of course, to understand how was the pediatric community or is the pediatric community affected by COVID-19? I heard stories that pediatricians would take care of adult patients with COVID-19 on occasion. So can you tell us a little bit about your experience both in Canada and Ana Catalina, or Mexico, and also in the US? Maybe Ana Catalina, do you want to start?
Sure. I can share my experience during the COVID-19 pandemics here in Canada. I have to say I'm very lucky because the numbers weren't very high here in Toronto. And in the hospital where I'm training right now, we didn't have the need to support the adult side. So basically, we were just looking after the pediatric patients. And we have a very good organization on all the things that needs to be done. However, in Mexico, with the contact that I have and my friends and my family and so on, yes, it's been very challenging for pediatricians because they have been called to participate on the adult care. And it's also shocking because it's for sure a long time ago that you did med school, and the way you treat the patients, it's very different. So it's been challenging from all perspectives.
Yeah, Maria, what about the US?
Well, I don't necessarily speak for all the US, but I can tell you some anecdotal information. We actually will be publishing a paper on telemedicine and during the COVID-19 pandemic for the pediatric nephrology community. So first, let me tell you what has happened within the clinical practice. So pediatric nephrologists and other providers who are comfortable with intensive care patients have had to cover the intensive care units so that the pediatric intensivists in turn can help the adult intensivists in their units. Second thing that has happened clinically, and that's my personal experience, is that our adult colleagues who do palliative care requested help from us pediatricians about addressing and providing palliative care services to others. And we had to be trained, and we've had to do, a number of us have to cover shifts in the palliative care team to help with those services. It's been challenging and it's been difficult. And also in our experience, we have a lot of Hispanics and African Americans. So most of our pediatric intensive care unit patients have been from minority backgrounds. And that has also been very difficult for us to manage. In terms of telemedicine, and I know you'll have some telemedicine talks in the conference, in terms of telemedicine for the pediatric patient, telemedicine has been accepted both by the pediatric provider and the patient's parents. It's amazing to see how well the technology has penetrated, even among Hispanics. 89 to 90% of Hispanics have access to the internet, patient portals, provider portals. So telemedicine has been a good experience overall. It's a problem for us providers not to do a full physical exam, but we have enough information to provide services during this pandemic.
Really, thank you both for this wonderful conversation. And I have to say, I'm so much looking forward to your talk at the RRI conference. We are really proud and honored to have the two of you speak at the conference, two esteemed and leaders in the field. So really, thank you, and I'm looking forward to the presentation.
It was our pleasure. Thank you for the opportunity to speak with our collaborators across the world and across the ages.
Thanks for inviting us.